it's Victoria here at Low Carb Denver 2020, and I have a discovery in front of me. This is Jodi, Obstetrician and Gynaecologist from Australia. Very excited to have a colleague here.
Hello.
So Jodi, tell me about your low carb journey so far.
I guess I started low carb about 4 years ago, flitted in and out with low carb, keto type diets, and initially it was to help me with study and also with long surgery days, so I didn't have to eat as often. So I found that I had amazing energy and that I could operate all day just drinking black coffee and feel fine. So that was very effective for me. As I got further into it, I started to do some research on the benefits for my patients, and with some of my patients I have advocated for low carb or ketogenic diets.
So you got into it by yourself first. How did you discover it?
It was my brother. My brother is in engineering in the mines in Western Australia, and he's very big into fitness and research, and he did some research and started a ketogenic diet himself, and I looked at the science for him.
So what was your main incentive to start? Was it weight loss, or was it just to feel better?
Yeah, basically, weight loss is always good, but just mainly for my own stamina and my ability to study, and it went from there.
And what sort of training had you had in nutrition before that?
Oh, basically none. Only my medical degree, which there's not a heavy emphasis on diet. So I basically used my medical degree to do the research myself.
Okay, and initially when you heard about it, did you think, wow, this is crazy, or did it make sense?
It sounded crazy. Increasing your fat is something that we've been told is really wrong. So it sounded crazy, but I was open to it.
Fantastic. And so now, are you doing more obstetrics or more gynae, or a mix?
Yeah, so about 2 years ago, I completed my fellowship training and started private practice, and I have a busy, thriving private practice in Wollongong. I do both obstetrics and gynaecology, quite a lot of gynaecology, a lot of long operating days where I can operate 15 to 16 hours, and that happens about once a week, sometimes more. I also do about 16 to 20 obstetric deliveries a month, and I have 5 children. Well,
Superwoman.
So I am very busy, and being keto or having a low carb helps me with that.
Absolutely. And tell me, are you using it for PCOS or prenatal?
Yeah, so that's the reason that I came to this conference, was to get more information on specifically the benefits for PCOS. I know that that's emerging evidence, but to me it makes a lot of sense. I've had some really interesting patient outcomes. One type 1 diabetic obstetric patient who was already doing low carb herself, and I encouraged that throughout the pregnancy, and she had the best sugar control in that pregnancy that she's had in her type 1 diabetic life. I also work closely with a dietitian in Wollongong who's very low carb focused. So she had gestational diabetes in her own pregnancy, and became low carb herself after going to the diabetes clinics that were pushing for increased carbohydrates for her. It didn't make sense, so she moved into her own low carb eating and improved her gestational diabetes, and now she's educating others. So I've used her with specifically a very high BMI patient who booked in with me and didn't really, at that time, 9 weeks pregnant, didn't know that she was a diabetic herself, probably type 2, had very high blood pressure. She had a really good obstetric outcome with a very complex pregnancy management, both with myself and the dietitian.
And so have you managed to have chats with any of your colleagues, and is it being well received? Do they know what you're doing?
That's difficult. I think it's still very controversial. I know that my close colleagues know that I do low carb or keto. I don't know of any other people around my area that do it. I keep it sort of close to myself. I bring it up with patients intermittently, but I don't push it for all of them.
Okay, so do you still feel like an outlier?
Yeah.
Yeah, it's quite hard, isn't it?
Yeah. They don't understand it, and it is very different to everything that we've been taught. And I think, it's controversial still, even within the medical community.
So what led you to come to Low Carb Denver? Have you been to other low carb conferences in Australia, or?
No, really I was looking for a conference to go to, and my husband had a conference in Las Vegas earlier in the week, so when I was searching I found Low Carb Denver and I was like, wow, this is perfect.
Oh, that's amazing.
Yeah.
So maybe you'll come to some of our Sydney ones.
Yeah, that's my intention.
And tell me, do you do the diet advice yourself, or do you have a nutritionist with you?
So I don't have the nutritionist in my rooms. I do the initial introduction to the diet. I explain to them the benefits that it's had to me, the benefits that evidence has shown, and then I direct them to websites, and then I refer to my dietitian.
And are you having longer consults because of this? Because it's quite hard work doing that.
It is hard work, yeah. Because I'm in private practice and I'm able to charge a fee for my consultations. I do actually spend a lot of time anyway with my new bookings. So new bookings are 40 to 60 minutes, so it gives me time.
Yeah. And what about fertility? Have you seen any success with fertility?
I don't do fertility myself specifically, because to do fertility in gynaecology requires you to really focus on fertility. So I do direct people to Kogarah if I think that they need more diet focused, but with my polycystic ovarian syndrome women, I do introduce them to the diet.
And I have to ask, 5 children, so is it a low carb household then?
Oh gosh, no. I've got 5 sons. So 3 are mine, 2 are my stepsons. It's very busy. When we have them week on, week off. And during that week, my husband does a lot of the cooking. He and I do low carb, and we just bulk up the children's food with carbohydrates, but healthy ones, because they're growing.
Yeah, amazing. Well, I'm not really sure whether we should go back down to the conference now and get back into Denver 2020. So thanks so much, Jodi.
Thank you.